What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we will cover what it's like to be an X-ray tech in 2024. So you want to be an X-ray tech. What's it like, Miguel? I will give you context. I am a fellow X-ray tech. Graduated during the COVID epidemic, one could say the most horrendous of times, especially in our field. I was blessed to graduate towards the end of that because it was very bad if you were actual tech in the field during that time. Let's just say they were ordering chest x-rays a lot. Oh, the radiology department got hit very bad during that time, especially ours and CAT scan. So it could go both ways. So I work at a trauma 3 ER. So in this facility, I work the night shift, 7 on, 7 off. Night shift ain't always for everyone. I would say give it a shot. If you like it, good. If you're like Miguel, this is all you can do for the rest of your life, I would say that it works for me. You get paid the more monies out of everyone in the radiology, like X-ray one, because night shift gets the most monies. So that's that. Workflow, I would say, yeah, there's only 2 of you, but on a daily basis, it is very, very chill. I would say during the whole workload of your 7 days, I would say maybe 1 to about 3 of those 7s out of the month, you may have to work hard, like some day shift level energy of workload that you're just constantly nonstop. Usually it's like it spurts at the beginning of the shift and then tapers down, and then you go to morning portables, and then it'll be chill. And you can just be chilling. You could literally be chilling on your phone, take naps. Like, you can be with the other partner, you can take turns. Make sure someone's always awake to make sure if something comes in, it gets done, because let's say if y'all both fall asleep and something spawned in, y'all didn't see it, and delay patient care, you can get fired. So there's that. I would say out of all the positions in my hospital, the X-ray field, I have the most work-life balance, because I'm not stressed at all. Like, the level of stress in the medical field, I would say would be pretty high. To give you context, my lady's a nurse. Her level of stress, I would say, would range between a 7 all the way to a 9 with her current job. If you work in the ER, you could probably push a 9 or 10 on a daily basis. On the other hand, I am on a regular basis maybe a 2. Occasionally on those nights that it gets high pace, a 3 or a 4. But besides that, I'm stress free. Occasionally the most stressful is, the good portable's down, or we're having an update at nighttime and you'll have to put in stuff manually for a little bit. That's about it. But as soon as I leave work stays at work. I don't have to bring the burden of what's going to be happening the next day, or I don't have to worry about that. As soon as I leave work, you just enjoy your life. So to me, that is very nice. I would say if you enjoy that. Other people enjoy doing the travel tech gig. I have not looked into that because I have little ones and I need something stable and at home with those traveling gigs. I mean, you probably check out another video, but for the most part, you land contract jobs at certain hospitals, and majority of the time it's because they're understaffed and need help really bad. So if you're gonna go over there, majority of the times you're gonna be working. 10 8. Yeah, you get paid like more money, but you're gonna be working. And right now, where I'm at, yeah, I get paid for way less than if you would do traveling. But I am chilling, enjoying life. Very work-life balance. So we do, compared, I would say almost compared to all the other degrees you can get within the 2 to 4 range degrees, like of the basic entry of medical field. To give you context, you have like Xray, nursing, the people who do the, what's it called, PTA, like just like the basic entry level to the medical field. Out of all those, I would say we would have the most chillest, less stressful gig, as far as not having to deal with that crazy amount of patient work, like dealing with, well, we deal with, you can deal with every patient technically if they have something scanned, but like maybe 30 seconds to a few minutes, and then boom, back to the nurse or anything. All the nurse got to do. As far as like even documentation wise, we really don't have to document that much. We don't have to stress about stuff as much like that. Occasionally, maybe more if you're in the main. So I would recommend it. As far as pay wise, if you're curious about that, it can range depending on your state and depending if you're at the hospital or if you do mobile. So it could range, but I would say an average, like for instance, I live in Texas. I live in a more, I wouldn't say like Dallas or nothing, but the outskirts of Dallas, like an hour, 2 hours away from those big cities. You could range, I would say, an average of 20 all the way to 30 is a good range of pay. If you're not in the big cities, if you're just on, like I live in my cities, like 80,000 people? It's not crazy big. I'd say that's a pretty good range of pay, depending on your experience and all that. And then once again, if you had CAT scan and all that, of course, your pay would get more. So I'd say you could live a average life with this. You can live pretty good, I'd say. And then, of course, if you want to excel said career or your income, you could do travel. You could, there's always overtime. They're always gonna need someone to push the button. Especially at the hospital, they always legally they had to have 2 people always there. Like as far as if you're like, is the job gonna be stable if you work like for instance at the hospital? There's always gonna be work at the hospital. They had to have a certain amount of people to run the department. Now, if you can land one of those full-time position jobs, and as long as you're an okay tech. You don't even have to be good, just an average tech. As far as job security, as long as you ain't like messing up a lot, or you're not pissing off other people in your department, or you're not getting rid of, you can have a very stable job. Like there's people who've been doing this for 20, 25 years, and they're like, yeah, they're always gonna need us. Legally, they need 2 at night. As far as even when they cut down, like during COVID, they still had 2 people in the day, 2 people at night. And guess what? If you're night shift, they will never, ever, like in our hospital, like our manager even told us, she's like, yeah, maybe we'll like split the hours and then you might lose a few hours here and there, like snip a few to get you just full time, like your basic 40 hours. But you will never, ever be in a point where we'll have to get you down to 1 tech at the big hospital. Yeah, maybe like they might do that at like a smaller hospital, but at ours, they will always have 2. Like even if the workload of the amount of patient like drastically becomes smaller on average, they legally have to have 2. So that's something that once he told me that, I was like, yeah, as long as you do good, pretty good stable job. Now, compared X-ray versus CAT scan, on the other hand, I can't speak as much as the workload of CAT scan because I don't do that. But based off of what I've seen and what me and my manager have been talking about, the doctors, especially modern doctors, order a lot of CAT scan. A majority of the times they are very stressed. They do get paid more money, and they did, like, on average, let me give you some context. Every hour we can have a range between 1 all the way to maybe 8 exams in an hour, usually, give or take. That's how much work on average you can have. CAT scan, on the other hand, majority of the time their board stays. Like, we can hurry up and like shimmy around and shoot a bunch of people, and then we can be chilling, let's say that 1 hour. We don't have to take up the whole hour of work. We can probably shimmy it to 10. Even 5 minutes if the nurses are not in there. And then the rest of that 1 hour block, as we call it, we can be straight chilling. Like, we can just be there chilling, waiting until more patients come in. So we see it in kind of block increments. As far as CAT scan goes, because, like, we'll be chilling and they'll come in and like, yo, can you help us with papers? Yo, can, and I'll be looking at their screen. I rarely do I see their screen go to, I have no patients, or just 1 or 2, like, people to scan. Theirs stays stacked the whole time. They're always running and doing stuff, and like, I feel bad for them. Occasionally they'll get to chill and rest like we do, but it's not for everyone. Now, with this current economy, I would say, like, for instance, I love what I do. I will continue doing that. I will always be an X-ray tech. That will be something, that will be my base staple. Now, I may, here in the future, get my CT license and have that as an extra backup. As far as, I would rather go and pull OT in my X-ray department here at the hospital and make a few bucks less compared to if I had my CT license, and I'd rather have that as a backup. As far as like, oh, we don't have that much overtime in the X-ray. Okay, well, let me see if CT needs help, and then maybe work there. But as far as like being stressed out at a big hospital, me working 7 nights CT, I don't think so. It's not for, like, they look very miserable. Almost like being a nurse. Like, I would almost consider it that level of stress and stuff. So that's something to look into, I guess, up to y'all. At the end of the day, there's other students who come in and I tell them, and then they do it, and they're like, Miguel, you're right. I should have listened to you, but I'm so deep into this, they won't let me go because no one wants to do it here. Like, for instance, we have a position right now that just got open. It took them a year and a half to get anyone to commit to that role. And even then, that person got fired. Like, it's tough. Like, they've always stayed understaffed. They always had to call travel techs to come into their place because they can't keep it in one. Or they'll upgrade someone, like, say, my department, they'll cross-train them, and then they fuck around and end up fucking losing their license. Or, like, because they don't, what's it called, have the board certified CT. It's just cross-trained. Yes, we have techs there that have been there a few years, and they know how to do the job. They just can't pass through boards because they weren't trained via the educational side. So, I hope that gives you some insight of those two, and y'all can pick a career If y'all want to do this, yeah, it's been your boy Miguel. See ya on the next one.